Hello everyone, welcome back. Today what I thought I would do is show you a quick tape job for your foot if you tend to overpronate. This can help with plantar fasciitis, with knee pain, with hip pain, even sometimes with back pain. So this is a great tool to have in your toolbox. What you're going to need for this tape job is some cover roll stretch, and this is the 2-inch wide cover roll stretch, and some Leukotape P. Cover roll stretch. You can see that. Okay, I'm going to show you how to tape your own foot. So you're going to start with the cover roll stretch. I'm going to bring my foot across like this, and I'm going to hold my foot in a dorsiflexed position. So I'm bringing my toes back toward my knee, holding in this position. First, what I'm going to do is measure how much tape I'm going to need. You're going to start just below this knuckle, if you will, this metatarsal head, and then wrap behind your heel to the 5th metatarsal head, just below the knuckle, below the joint there. So I'm going to take my tape, put it around, make sure I've got enough for my size 12 foot. I said it. Size 12. Comes with the height. Okay, I'm going to cut along there. Also best to do this when your foot is clean and dry. You can even use some rubbing alcohol first. The tape will stick better. Okay, so I've got my tape here. I'm going to peel the backing off of the cover roll. This is the cover roll. And I'm going to lay this onto the skin. So starting just below this joint on my first ray here, I'm going to lay that along my skin to the other side. Ideally, you don't have any bubbles in the tape. Best case scenario. Okay. Should look like that. Good? Can't believe how much my foot you're going to see today. Okay, that's step 1. Step 2. Now I'm going to go just below that metatarsal head again from the middle of the foot. Okay. And I'm going to wrap around the dorsum of the foot to the other side to measure. Now, you want a little bit of space between the two ends of the tape on the bottom of your foot. That allows for your foot to move, allows for circulation. Otherwise, it's going to feel like your foot is too tight. The tape is too tight around your foot. It's going to be uncomfortable. So, from the middle of the foot below the metatarsal heads, okay, below these guys, going to apply the tape there, stick it down, and just lay it around the back of the foot, again staying below the metatarsal heads, and come around the other side and tape it down. If they don't meet exactly, that's okay. So they're a little bit, you can see it's a little uneven, that's okay. And you can see that there's some space still between the tape. Okay, now this white tape, which is the cover roll stretch, this is just to be laid on the skin. This is something for the Leukotape P to stick to beside your skin so that it doesn't tear at your skin. Okay, so now that that's on there, I'm going to get out my Leukotape P. Looks like that. I am going to again measure how much I need by taking some off the roll. I'm going to set it so the back side, the non-sticky side, against my foot, against that white tape, and I'm going to unroll it till it's up to near the top of the edge of the white tape on the 5th metatarsal head, below the 5th metatarsal head. Okay, so that's how much tape I need. You can use your fingers to tear if you're strong enough, or you can use some scissors to get you started. Okay, same thing. Now, I'm going to secure this on the first, below the first metatarsal head. So I'm going to stick it here. Okay. Rub it well, okay? Look at this. Got it stuck down there pretty good. My foot is still dorsiflexed, okay? Now I'm going to pull, I've got it stuck down really good at the top here. I'm going to pull down, stick it behind my ankle, grab the end of the tape, pull up, stick it here at the 5th metatarsal, okay, below the 5th metatarsal head. Now I'm going to press anywhere that it's not stuck to my foot. So pressing along in the arch, making sure it's nice and stuck. Okay, should have something that looks like that. Isn't this fun? Okay, stuck. I'm going to take our Leukotape P again, and we're going to go right along this other piece of cover roll stretch that we already applied. So I'm going to remove some tape, measure again with the non-sticky side against the cover roll around the back of my foot, about how much I need. I like to use my scissors. Tear that off. Okay, again, starting on the inside of the foot, underneath the first metatarsal head. Stick it, rub, rub, rub. Okay, make sure my foot is dorsiflexed. Now I'm pulling from here, pulling toward my knee, wrapping around the top of the foot, pulling, still applying tension, and sticking it to the other side. Okay, just like that. Now you can relax your foot. Okay, now, usually to keep this stuck on there as long as possible, what I'll do is I'll cut about 3 square wide strip, 3 squares wide, and remove the backing, and then I'll put that, this is the cover roll stretch again, put that on the ends. There's one side, and I'm doing the other side. Underneath here. All this does is help keep the tape from peeling up too quickly. So those two overlap, that's usually okay. Just like that. That'll just keep the tape stuck to your foot a little longer. Usually this tape job will last 48 hours, even if you shower. Sometimes people will say, oh, as soon as it got wet, it just came off. That happens. But this will help secure your arch, support your arch, so that you don't pronate and flatten out while you're walking or running, hiking, whatever the case may be. When you go to remove it, you do want to be careful. This tape can stick very strongly to your foot occasionally. Like I said, for some people it just falls right off in the shower. Other people will say, oh my gosh, it really stuck to my foot. So when you go to take it off, you want to peel up at the arch, cut with your scissors, and then gently peel it away. You do not want to rip this tape off like a Band-Aid. That can sometimes take skin along with it. You want to be careful. It can be very strong tape. But this is a great way to tape up your foot, easy to do yourself. These tapes can be purchased in most places, most medical supply companies. Amazon, of course, carries them. And quick and easy, do it yourself, arch support. I hope that was helpful for you. Thank you so much for watching, and we will see you next time.